Hi, my name is Shakib, and I'd like to give you a brief demonstration of the COVID-19 patient monitoring system. This system is designed to be open and capable of supporting any institution or health system across the nation. The system can handle every COVID-19 test captured in a single database that can then be used to analyze and improve our understanding of this pandemic. The patient monitoring system is designed to collect information from participants in real time and allow greater insight into this pandemic and how populations respond to it. Once you've signed in, you'll be taken to the home page. Here you can perform a number of different actions. Now, my account is currently set up as a health system coordinator, so let's begin from the very top. First, you'll need to load participants. Click on Load Participants from the home page, and then here you can go and drag and drop a spreadsheet in the specified format to load any number of participants, whether it's hundreds, thousands, tens of thousands, or more. Once you've loaded your participants, you can then begin to go and manage your health system. Clicking on the Health System tab will give me an overview of the health system that I'm currently a part of. Now, this application is designed to support any number of health systems. We've created one for development called Oracle. From here, I can go and add a number of different roles into my health system. Below the details, I can see all the participants in my system and the various different users that I have. Clicking on Care Facilities will show me a list of all the care facilities within my health system. Here I can see that I have a number of them. I can also filter these care facilities by state, city, or the primary care facility. Now, let's go and drill into a specific care facility. I'm going to click on Redwood Shores. And here I can perform a number of other actions, such as adding a care facility coordinator or setting other roles. I also see the details of this care facility, and I can scroll down to see the list of all the coordinators and other users that have access to this care facility. Clicking on Participants will show me a list of all the participants within my health system. Now again, I am the role of a health system coordinator. If I was a role of a care facility coordinator, I'd only see the patients or the participants for my care facility. I can also filter these participants by a number of different facets, such as the care facility, when they last provided an update, or what their patient status is. Now let's go and click on a specific participant. I'm going to click on Jennifer's record so I can see all the information I have on this participant. I can also perform a number of actions, such as sending a reminder email, changing the care facility, adding a guardian, and so on. Under participant details, I can see general information, the contact information, or other information about this participant. Scrolling down, I can also see the results of all the COVID-19 tests if they have taken any. The testing information displayed here can come directly from the participant or from the test provider. Further below, I can also see the daily updates that this person has provided on a daily basis. Currently, we only have one update. The next thing I'd like to show you is the actual participant experience. Once a participant has been loaded into the system, they'll be presented with an email to complete their enrollment and then provide a daily status update. Here, they'll see their information that's been loaded into the system and have an opportunity to correct it. They can scroll down and also answer a few relevant questions, such as are they a healthcare worker, yes or no? Have they ever been diagnosed with COVID-19? And have they ever been hospitalized since 2019? Then they simply click on Continue. Next, the participant is taken to the daily status page. On this page, they will see an engagement question near the very top, such as overall, do you consider yourself healthy, yes or no? And then, which symptoms the patient is experiencing currently. Do they have a cough, a fever, a shortness of breath, and so on. Selecting a symptom will ask them to provide additional information. I'm going to check fever and cough. Below, I can provide the highest temperature I've had, whether I've sought treatment for the symptoms, and whether I've worn a face mask or respirator. The daily update will also ask me if I've had close contact with the COVID-19 patient, and if I select yes, it'll ask me follow-up questions. Finally, do I have a new result for a COVID-19 test? I'll click no, and then click on Submit Daily Update. And that's it. That's the participant experience. It's designed to be as painless as possible so that we get accurate information on a daily basis. Back in the patient monitoring system, I can again take a look at Jennifer's record, and if I scroll down, I will see the daily status update that I've just provided. From the dashboard, I can see participation across a number of different areas, such as enrollment, the engagement, and whether they have been exposed. Here, I see a chart showing me the number of participants I've invited versus those that have completed enrollment. I can see the same information for engagement, so I can see the total number of participants I have on any given time versus the people that are providing daily updates. Now, there's a few other charts on this page as well, which I can then sort and interpret as I like. But the real value of this information is that this data is coming from participants on a daily basis that can then be further analyzed using data analytics tools. What I've shown you here is a user experience that is used to load participants, manage care facilities across a health system, that is then used to collect information in real time from the participants within it. The goal of the patient monitoring system, combined with the therapeutic learning system, is to provide a singular platform that can then be used to analyze this information and make more informed decisions about how to deal with this pandemic.